Now, cryptococcal meningitis and tuberculosis are proving to be fatal opportunistic infections for people with advanced HIV disease, which is a concern for the Ministry of Health. However, the Nakuru County Department of Health is leading the country in efforts to prevent deaths from advanced HIV disease by having centers of excellence like the Naivasha Sub-County Hospital, which apart from providing treatment for TB and a cryptococcal meningitis, has also established a patient follow-up system that ensures patients adhere to the treatment even after being discharged. NTV's health and science reporter Bridget Singana was in Naivasha and filed this World AIDS Day special.
Lucy Simiyu watches over her son at the pediatric ward at the Naivasha Sub-County Hospital. At 10 years of age, he has survived a bout of tuberculosis that saw him admitted here in September, only for him to be readmitted in November, this time suffering from cryptococcal meningitis.
Akaanza kukunjana, ukimkaisha shingo inakauka, miguu hayatembei, anashindwa kukaa, ukimweka kama ukapotea anaanguka. Nikaona anaanza kuconfess kama ni siku mbili. Nikampeleka South Lake hospitali, naanza akaniandikia barua akanituma huko. Sasa kukula imekuwa shida, chakula haipiti kabisa, ukimpea tu anakoa inarudi. Hata maji kimpea inakaa kwa mdomo.
At 26, Martin, not his real name, was brought to the Naivasha Sub-County Hospital in critical condition. And apart from him having tuberculosis, Martin has also presented with symptoms of cryptococcal meningitis.
Sababu nilikuwa naumwa na kichwa kabisa. Sasa ndio nikakuja huku. Wakanishughulikia vizuri, wakakuja wakaniweka oxygen, mwili ikaanza kuimprove, appetite ikarudi.
Both Joel and Martin are patients with advanced HIV disease, which occurs when a patient living with HIV has a CD4 cell count of less than 200 cells, while all HIV-positive children younger than 5 years of age are considered to have advanced HIV disease. This includes both individuals who are learning about their HIV status for the first time or those returning to antiretroviral therapy after interrupted treatment. Cryptococcal meningitis is a rare fungal infection that affects people whose immunity has been compromised, like people living with advanced HIV disease. It is fatal if not treated, and since September this year, health workers at the Naivasha Sub-County Hospital have been able to screen and attend to patients presenting with this disease, most of whom have advanced HIV disease.
Those that we've been able to admit for care have been around 17. And amongst those, there are around 6 that we have lost, those that have died, because they either came very late. They also came with conditions that were complicated, especially cryptococcal meningitis, TB meningitis, and we were not able to complete the treatment.
Cryptococcal meningitis has been listed by the World Health Organization as a neglected tropical disease owing to the complex treatment and lack of drugs to combat the disease that kills 30,000 people living with advanced HIV disease annually. More than half of these deaths occurring in sub-Saharan Africa, according to the Drugs for Neglected Diseases Initiative. Symptoms include fever, headache, stiff neck, nausea and vomiting, increased sensitivity to light, and confusion.
These patients are presenting very late. And they're presenting late when we already have those opportunistic infections that if you don't handle, they will succumb. So the mortalities becomes a burden. It's very high. Most of the time, these patients, their cell counts are very low, lower than 200. So even if you are struggling, like the child I talk about, the cell count was around 4. So you see your immunity is so low that if you are not able to manage this, the mortality rates are high.
We've worked with several countries, Kenya included, is to promote adoption of the advanced HIV disease package of care, which has cryptococcal meningitis treatment package as well into our guidelines, and being able to follow and ensure that our facilities are responsive and are able to manage these patients.
The Naivasha Sub-County Hospital is now serving as a point of reference for patients with advanced HIV disease, owing to the follow-up system they have put in place to ensure patients with AHD do not fall off treatment for both tuberculosis and cryptococcal meningitis.
So Naivasha Sub-County Hospital is a hub. Then from this hub we have several links, which we are calling spokes. So those that we've been able to discharge from the wards alive to the spokes, meaning we are still following them, but not within the hospital. I've been around 6, 7, and they still keep our comprehensive care clinic is actually in touch with the spokes to be able to know their progress.
We are training community persons so that they can be able to have, one, access to care, also the information about advanced HIV disease. Tuberculosis treatment is also very long, although now we have shorter regimens, but it is a bit tough and also very stigmatized. So we need the champions to support these clients to continue to take this treatment when they are back in their community and to avoid the stigma that is around them. And also for cryptococcal meningitis, which may be a little bit longer, can go up to at least 1 year. And as a survivor, it's important to have this support around you so that you continue with that treatment.
Since this hospital became a center of excellence, Dr. Owuor has also noted that those presenting with advanced HIV disease have fallen off antiretroviral treatment.
Is to try and address wholesomely what are these challenges that are making these people drop off care. So we are revamping the comprehensive care adherence counseling, the support through the healthcare promoters. These are people in the community who will be able to find out in your household what could be the issue other than just the hospital.
The health workers here are also paying keen attention to the men presenting with AHD because they are highly likely to die from the opportunistic infections.
Women tend to seek health care better than men. And within the experience in the comprehensive care, their timings for the men is also a challenge. They wouldn't want to be just appearing during the day, and most of the facilities are not responding to that time gap. So that could be the reason why we've not caught many men, but they are there.
Men do not talk, men do not seek for help. They usually come in their late stages. But what we are doing in our clinic, at least we have a mentor father. This mentor father talks to them regularly. He does home visits. In case we have a treatment interrupter, he goes and comes back with the client. And also we are trying to talk to them. We have support groups for men. We are supporting them where we can.
Efforts are underway to develop a less toxic and shorter treatment regime for cryptococcal meningitis.
So we are developing a drug that can be given twice daily instead of 4 times. And also this drug can be given, it is a pellet formulation, so it can be mixed with water or suspension.
More than 480,000 men are living with HIV in the country as at now, with 7 in every 10 deaths, AIDS-related deaths, happening again within the male population. This year's World AIDS Day celebrations is focusing on men and boys in terms of getting them to know about their HIV status and also adhering to treatment. Advanced HIV disease is also prevalent in the male population, and the Ministry of Health hopes that by targeting men and boys in the campaign against HIV and AIDS, they'll be able to alleviate the deaths that result from advanced HIV disease. Bridget Ngana, NTV, at the Naivasha Sub-County Hospital in Nakuru.